Have you ever wondered why mental health issues seem to be on the rise in Black communities? This is a question that's been echoing through the halls of academia, the offices of healthcare providers, and the homes of countless individuals. When we talk about mental health, we're referring to our emotional, psychological, and social well-being. It affects how we think, feel, and act. It's about more than just the absence of mental illness. It's about having the tools to manage life's challenges and bounce back from adversity. Mental health awareness is crucial because it helps us recognize when someone might be struggling so that they can get the help they need. It's about breaking down the stigma that often surrounds mental health, making it easier for individuals to reach out and seek support. Now, let's delve into the crux of our conversation today: the alarming rise of mental health issues in Black communities. This isn't a localized issue. Rather, it's a widespread concern affecting Black communities across the globe. Recent statistics paint a concerning picture. Black individuals are reportedly less likely to receive mental health services than their white counterparts. Moreover, they are more likely to be misdiagnosed. The National Alliance on Mental Illness reports that Black adults are more likely than white adults to report persistent symptoms of emotional distress, such as sadness, hopelessness, and feeling like everything is an effort. The disparities don't end there. Black teenagers are more likely to attempt suicide than their white counterparts, and Black men are particularly at risk, with suicide being the third leading cause of death for Black men ages 15 to 24. As we can see, the situation is indeed alarming, but what are the reasons behind this increase? Stay tuned as we delve deeper into the underlying causes in the next segment. What factors are contributing to the rise in mental health issues within Black communities? This is a question that requires a deep dive into societal, cultural, and systemic reasons. Let's start with societal factors. The Black community has historically faced a series of socioeconomic challenges, including racial discrimination that can cause significant psychological stress. This stress can, over time, lead to an increase in mental health issues, including anxiety, depression, and post-traumatic stress disorder. Cultural factors also play a significant role. The stigma surrounding mental health within the Black community is a major barrier to seeking help. Many people feel that they must keep their struggles to themselves, or they may not even recognize their symptoms as a mental health issue due to a lack of awareness and understanding. Systemic reasons add another layer to this complex issue. Discrimination in healthcare, unequal access to mental health services, and the lack of Black mental health professionals all contribute to the increase in mental health issues. The truth is, many Black individuals do not have access to the resources and support they need to manage their mental health effectively. Now, let's delve into historical trauma. The Black community has a long history of racial trauma and discrimination. This history has not only affected individuals, but has been passed down through generations, leading to what some experts call intergenerational trauma. This ongoing cycle of trauma can have a significant effect on mental health. Microaggressions are another contributing factor. These are subtle, often unintentional discriminatory comments or actions that can slowly erode an individual's mental health over time. The cumulative effect of these microaggressions can lead to feelings of alienation, isolation, and increased stress. The ripple effects of these factors are profound and far-reaching, impacting individuals and communities alike. These are not isolated issues, but are interconnected, each one feeding into and exacerbating the others. The task at hand is to break this cycle, to create a society where mental health is prioritized and everyone has access to the help they need. How does this mental health crisis affect Black individuals and communities? Before we dive in further, we have a quick request. If you're enjoying this video and want to show your support, don't forget to subscribe to our channel. This way, you won't miss out on any future videos we post. The impact of mental health issues on Black individuals and communities is profound. It's not just about the individual suffering, but it reverberates through families, friendships, and entire communities. It's a ripple effect, where one person's pain can lead to another's. But it's not just the emotional turmoil that's worrisome. There's also a societal cost. Often, those grappling with mental health issues find themselves facing barriers to education, employment, and even housing. This, in turn, perpetuates a cycle of poverty and marginalization that's hard to break. And then, there's the stigma. The stigma surrounding mental health in the Black community is a formidable obstacle. It creates a silence, a reluctance to seek help. It's a barrier that's often erected by misconceptions, misunderstandings, and deep-seated cultural beliefs. This stigma not only prevents individuals from seeking help, but it also hinders the community's ability to collectively address the issue. In a nutshell, the mental health crisis in the Black community is not just an individual issue. It's a community issue, a societal issue, and a human rights issue. The response to this crisis at various levels, from individuals to governments, is critical in mitigating its effects. How have governments responded to this crisis, and what solutions can help alleviate the situation? Government responses to the mental health crisis among Black communities have been varied and inconsistent. Some governments have recognized the severity of the issue and have allocated resources to address it, while others have yet to take significant action. For instance, a few have funded research into the disparities in mental health care and have taken steps to reduce systemic barriers to access. However, these measures, while commendable, are just the start. The crux of the solution lies in a multifaceted approach. This involves not only increasing funding for mental health services, but also ensuring that these services are culturally competent. Culturally competent mental health care means understanding and respecting the unique experiences and needs of Black individuals. This includes acknowledging the impact of historical trauma, racial discrimination, and social inequities on mental health. Community support systems also play a vital role. These systems can provide a safe space for Black individuals to share their experiences, obtain support, and learn coping strategies. This can help reduce the stigma associated with mental health and encourage more people to seek help. Moreover, governments should invest in public education campaigns to increase mental health awareness. These campaigns should aim to dispel myths, reduce stigma, and promote dialogue about mental health in Black communities. Finally, policy changes are necessary to address the systemic factors contributing to mental health disparities. This includes tackling racial discrimination in healthcare, improving access to quality education and housing, and addressing income inequality. The solutions are within reach, but it requires collective effort and commitment. In conclusion, the mental health crisis among Black communities is a pressing issue that requires urgent attention. Our journey today has unveiled the alarming rise in mental health issues, the complex societal, cultural, and systemic reasons behind it, and the profound impact it has on individuals and communities. We've also delved into the government's response and potential solutions, emphasizing the pivotal role of culturally competent care and community support. For more insightful content, don't forget to like, share, and subscribe to Air and Vitality. Let's continue this important conversation about mental health awareness and support in Black communities. Together, we can make a difference.